Okay, so in this video we're going to discuss the effect of nitroprusside on the pressure volume loop. So first, to start, we need to understand how a pressure volume loop works and what are the normal pressure volume loops labelings. So we'll come to another slide. What we'll do is we'll draw a pressure volume loop P and V, and we will draw the pressure volume loop here, and like this, and then this. Alright, let's say this is the normal pressure volume loop. Now you have to talk about which areas of this graph represent what exactly. So this line, first of all, this line here represents end systolic volume, and this line here represents end diastolic volume. This makes sense because end diastolic volume, you can see, has a larger volume than end systolic volume, which obviously is how normal works. Now you can see that after end diastolic volume there is a rapid rise in the pressure, which could easily indicate to us that this is the isovolumetric contraction of the ventricles. So now at this point we have the opening of the valve, which is the aortic valve opens at this point, and then there is a rapid decrease in the volume, as you can see, which would mean to us that blood is passing through the aortic valve into the systemic circulation, which would finally result in at a point where the aortic valve will close, right? Yeah. So first it is open and then it is closed, right? So then the pressure rapidly drops because obviously the heart, this is called isovolumetric relaxation of the heart, which results in rapid decrease in the pressure. And here you have the volume at the end, which is the end systolic volume, because the systole was here. This was the systole, and at this point you can see the diastole happening at this point, right? So, right after all this, what we can we'll first remove all of these drawings, and we also need to know how the preload and afterload is represented in this diagram. So what is preload and what is afterload? Preload is the pressure, preload is the, you can say, the volume which comes into the ventricles and which fills the ventricle. So if preload increases, that means that you have increased blood coming into the ventricles. If preload decreases, that means you have decreased blood flow coming to the ventricles. And secondly, afterload means the pressure against which the ventricles have to beat. So the ventricles, that would mean, for example, if there's systemic vasoconstriction in the peripheral circulation, you have increased afterload. That would mean increased pressure against which your left ventricle or the right ventricle has to pump. So afterload is the pressure against which you have to beat, and preload is the pressure or the volume of blood that comes into your ventricles and expands it. So in this diagram, obviously, let's take it one by one. First, let's talk about preload changes. Now imagine, for example, imagine that your preload, let's say the preload increases. So if your preload increases and the blood comes into the ventricle, it goes down into your, let's say, left ventricle or the right ventricle, for example. Let's say the right ventricle, because the preload usually comes from the systemic veins most of the time, and it accumulates into the ventricles. So now in the ventricles, at what point in the cycle does blood flow into the right ventricles? You would say diastole, right? So at the end of diastole, your blood will be in the right ventricles. So if preload is increased, that would mean we have increased the amount of blood coming into the ventricles, and so the amount of blood at the end of diastole will be more than it was in a normal condition. So here what we would see is our end diastolic volume is increased, right? Now this is in cases of increased preload, right? Now what if the preload decreased? What if the preload decreased? Well, if the preload decreased, obviously you end diastolic, there will be less blood coming into the ventricles, and at the end of diastole also you will have less blood as compared to before. So your preload will be somewhat here at this point, right? So we understood differences on how exactly is the ventricles, is this diagram affected if preload is changed. Now once we're done with the effects of changing preload on this system, we'll now talk about the effects of changing the afterload of this system. So first of all, I'll change the color of my pen to indicate afterload. Right, so now we'll be talking about afterload. The afterload is the pressure against which the heart has to beat. Now remember that when I told you about the systole, which is shown with this blue arrow here, there's a maximum pressure in this entire system at this point. This point here is the max pressure at which our system works. So basically when the aortic valve opens at this point, it beats, the blood is pumped against the afterload and until all the blood from the ventricles is emptied. Now if your afterload is increased, if your ventricles have to pump blood against more resistance than before, then obviously the pressure that they will be pumping against will be more, and the heart won't do as much work as before. So because of the increased pressure which is opposing it, the pressure with which you are pumping the blood out will decrease. So obviously from this point that I've circled, the maximum pressure will come about at this point. This is in cases of increased afterload. You get the point. Now let's discuss the other situation. What if the afterload is decreased? What if there is very less resistance? For example, we say peripheral vasodilation. There is less pressure against which the heart has to beat now. Now you will be able to pump a lot of blood with more force this time because there's nothing opposing you. So now your maximum pressure will increase to this point. So these are the effects of the changes in preload and afterload. Now keeping this in mind, we have to move on to the effect of nitroprusside. So I'll change the slide. So now, nitroprusside, we need to know about the mechanism of action or the effects of nitroprusside. Nitroprusside is a vasodilator. It's an arterial and a venodilator. Let's see what that means. If you increase, so nitroprusside mechanism of action. It increases dilation of arteries and it increases dilation of veins. Increased dilation of arteries results in decreased afterload because now you have less resistance against the flow of blood in the arteries, and increased in dilation of veins will result in more blood in the veins, which will result in increased venous return, which will obviously result in, I'm sorry, I think I made a small mistake. What I meant to say is, because of increased dilation of veins, we have more blood pooling in the veins and stays in the veins rather than moving on to the right atrium, which results in decreased blood coming back to the heart, which we can put, according to the terms we mentioned, preload, decreased preload. So what we can see is we have both decreased afterload and on top of that decreased preload. So how does that come in the picture that we were talking about? Here we said that at this point we said the preload is decreased, and at this point we said the afterload is decreased. So now we have 2 points of our graph, of our new pressure volume loop already set. We know according to this we can build up the rest of the graph. Right, so let's sketch it. We know the maximum is at this point, and we know that the maximum of this point is at this point. So what about the distance in between? How big is this? Thing is, if you decrease the preload and you decrease the afterload, that means you're balancing the stroke volume anyways. If it was just a change in one of the parameters, the stroke volume will be affected. But since we are changing both the preload and the afterload, there will be no difference in the stroke volume of this patient. Stroke volume is shown in a pressure volume loop by this parameter. So now we know that the width of the new pressure volume loop is equal to the width of the previous one. So now we can draw this as a new pressure volume graph according to, like, I'll show you, as this. So now we have this, it comes down at this point, it goes here, and we have to make sure that the distance between the two big lines is the same, and we drop this line down here. So this is the new pressure volume loop that we have achieved by nitroprusside because of decrease in afterload and decrease in preload. Now there's another thing I want you to notice at this point is that there is an imaginary line drawn between this point, which is the, I'll show you which is this point to this point. Now this line here represents the contractility of the muscle, and this contractility is affected, for example, with drugs or probably the blood supply to the heart, myocardium itself. But since the contractility of the heart is not affected in this case, this point and this point should pass through each other. That would mean the contractility has not changed, which is true for nitroprusside. It does not affect the contractility of the heart muscle at all, and so this line will pass through these 2 points, and the stroke volume will remain the same, and we have a change in the end diastolic volume. We have a change in end systolic volume also. Why do we have a change in the end systolic volume? What is the end systolic volume? End systolic volume is the volume left in the right or the left ventricle after systole. So we talked about the fact that we have changed the afterload. We have decreased the afterload. The heart does not have so much pressure left to pump against it. So it will be able to pump more blood this time, right? It'll be able to pump more blood into systemic circulation at the end of systole. So this is the reason that at the end of systole we have lesser volume present in our ventricle, which has not been pumped. So now at the end we have decreased both the end diastolic volume and the end systolic volume, and this yellow graph is the one you are left with for a nitroprusside drug usage on a myocardium.